How well does your medical practice collect fees both from your patients and from third-party payers? Can you do better? And how much better could you do by really trying? Welcome to the Business of Medicine. I'm your host, Dr. Larry Kaskel. Joining me today is Paul Donadio, District Sales Manager for Green Flag Profit Recovery by Transworld Systems. Transworld Systems has extensive experience in the healthcare industry as a preferred administrative partner with the MGMA and was recently peer-reviewed by the HFMA. Paul, welcome to the show.
Thank you. Glad to be here.
Let's start with just some basic finance of a basic medical practice. In your experience, what percentage of outstanding receivables actually get paid on time?
It's hard to tell because with the insurance payments, reimbursements from insurance companies taking so long, it's hard to gauge. But we do find from our medical practices that if they do not recover their payments within 90 days, the recoveries fall less than 4% after that.
Wow. So if I'm hearing you correctly, if you don't get your money within 3 months, you ain't going to see it.
Correct. I mean, what we find out from a lot of the medical practices out there is they need to get on those self-pay accounts sooner. That they have to think of someone not making that payment as a stolen car, because the sooner you report that stolen car, the chances of finding it are a lot better. And that's what we try to teach the practices that we deal with is to, think of it the same way, because the longer it goes, the tougher it is to collect that money.
I thought insurance companies have been pressured into paying on a more timely basis these days. I mean, in my practice, I'm seeing the DAR go down to about 28, 29 days.
Absolutely. Insurance companies have absolutely gotten better over the last couple of years. However, we do find out with some of the insurance companies that if they pay 4 out of 5 of the claims, there's 20% of practices payments that do not get paid on time. And if they can just delay that for another 30 days, it's money that they don't have to send directly to the providers. And that's where, we can help actually with self-pay as well as insurance reimbursements.
Well, do they eventually send it? They're just holding it to hold on to the juice a little longer?
Absolutely.
Even though there have been a gazillion lawsuits against them and class action suits, they still do that?
Again, we find out from some of our practices that if they have claims that haven't been responded to within 60 days, we absolutely tell our practices to turn the accounts over to us because we can get some form of answer from the insurance companies as well.
Where do you begin when you go into a new client? If you had to create a checklist of, let's say, a best practice for billing and collection, where do you even start?
First of all, we ask a practice if they do have a financial policy in place. And we do find out that some people have them, but a lot of people don't adhere to them. And we actually tell our clients that your patients should know upfront what is their responsibility, as well as what's expected if payment is not received in a timely manner. So having that financial policy in place is a win-win situation, and finding out who is responsible for doing what is very powerful. And we also find out that some of the receptionists are only doing what they're supposed to do to answer phones, but they're not asking for that copay at the time of visit, and that's where we find out that people are uncomfortable asking for money at the front desk.
Tell me about copays. I mean, if you don't get that copay, what are the odds that you'll ever get that copay?
It's a 50-50 because if someone has several visits and their $20 copay hasn't been paid, after a couple of months, that's going to quickly get up to $60 worth of bills. We're trying to educate them that they have to have a sound financial policy in place, and everyone has to know what their role is. That's very important.
It would be nice to have a script for them up front.
Absolutely. And we go in there and teach them scripts. We even tell some of our clients, and it's great to walk in some of my practices, and we have them put on their counter that if a bill is not paid within 60 days, the account automatically transfers to a collection agency through our computer program. It's not us. Make arrangements at time of service. When I see that sign, I get a smile on my face because we know our practices are listening to us. And even the office manager who says, Paul, when people see that sign, it's amazing how they take out their checkbook just because they hear the word collection agency, that the checkbook comes out and the payment is made at time of service.
All right, well, let's dispel some of the myths of collection agencies because when I think of that, I think of Rocky Balboa coming to break my kneecaps.
Absolutely. That's one of the biggest hurdles we have to go through as being a collection agency. And what we've been around for 37 years, and what we've preached ourselves as marketing our services as an early out, what we mean by that is our approach is diplomatic. We're almost like a delinquent account billing company. So our approach is a little bit different as opposed to working that account in-house for 6, 7, 8, 9, 10, 12 months, and then they pitch it over to a collection agency because they figure, well, if I collect 40% or 50% of something at this point is better than nothing. Our clients are trained to use us between 60 days, 90 days. We have a softer approach at getting the money collected. We also direct payments to come directly back to the practice, so we let them know that the patient can still, in fact, deal with the doctor's office, which is great. And once a bill is paid, we even send out a thank you card, which is sort of our hallmark, because that thank you letter lets them know that the door is open to continue seeing the doctor. Have you ever heard of a collection agency thanking someone for paying a bill?
I have not until today.
Okay.
Well, Paul, how good are you at what you do? I mean, what are your success rates? What percentage of money that's handed over to you do you actually recoup for the doctor?
Sure, great question. As if you log on to transworldsystems.com, you'll see that we boast a 56% recovery rate, but that is based on every industry, whether you are a dentist office, a supplier, a car parts distributor. With medical, I'll use a good example of one of our big practice management providers, Athena Health. We have about 145 practices submitting accounts to us right now, and we are achieving a 40% recovery rate for those practices alone. In medical, I'll go into some practices, and I find out that some practices are getting anywhere between 2 and 8%. And the reason is that they're waiting so long to turn it over to the hardcore tactics of collections. And that's why we're trying to educate the clients. The sooner you get on that account, the more recoverable it will be.
Do you see any doctors tipping their hat to the credit card industry and actually charging interest? I mean, it seems like it's been a taboo for doctors to charge interest on an old invoice.
That's a tough question. Again, depending on what is on that financial policy, but we tell our clients that if someone owes $50 and you're coming back and telling them that they owe $65, there's a pretty good chance they're only going to pay that $50 balance. And we do encourage that our clients not to add on any usurious charges or like a 20 or 30% charge. Try to collect what's actually owed to you. I know if a patient comes in and has that $50 balance that's owed, yet the doctor's saying they owe $65, there's a pretty good chance that the patient may only pay that $50 balance.
If you've just joined us, you're listening to The Business of Medicine on ReachMD, XM 157, the channel for medical professionals. I'm Dr. Larry Kaskel. My guest today is Paul Donadio. Paul's the district sales manager for Green Flag Profit Recovery by Transworld Systems. And Paul actually helps doctors get the money they're owed. Isn't that nice? Paul, let's talk about some things that we currently do in our medical practices and tell me if they're obsolete or they don't work. Like 3 things: phone calls, emails, letters. How do you respond to all those?
We have found out that most practices that make phone calls are getting a response rate of less than 10% because people just don't answer their phones. Most people have caller ID, and if they know that someone's calling and it's about a particular bill, they just will not pick up that phone. And most people nowadays are walking around with a cell phone. Again, answering that call from a doctor's practice isn't a priority, especially if they know that money is owed to that particular practice.
I want to tell you what we do in my practice and tell me if it's a good idea, bad idea, or you're going to take it and run with it. We have a credit card policy where every new patient has to submit a credit card, and we tell them that if nothing is received by them or their insurance company after 120 days, we will charge their credit card. And it's worked out pretty well. 98% of the people will give us their credit card. And so it kind of goes against what you're saying, that you should get the money within 60 days, but we're kind of giving them 120 days before we do anything because we found that, the insurance companies will eventually pay it before 120 days. What do you think of the whole concept?
Well, if you're getting a 98% recovery rate, that's great. There's still that 2% out there that probably will never pay. People may switch credit cards.
Right, they do.
What are you doing to combat that?
We call them up, and then we can't get a hold of them.
Exactly, and that's where you run the risk. You're on a slippery slope there if you're waiting 120 days to get that credit card charged.
Can we move it up to 90? Are we in better shape? You're even saying 60 days.
Again, depending on your turnaround from the insurance companies, if your days out is roughly 28, 29 days, why give them another 90 days to move?
Mm-hmm.
Maybe just do another 30 days and move that up to 60 days.
And then if the insurance company does pay us, we just kick it back to the patient.
Correct.
Tell me, Paul, a little bit about what's unique about your company, Green Flag Profit Recovery.
Sure. again, we market ourselves as an early out to traditional collection agencies or attorneys. Again, we find out that the sooner a practice gets on an overdue account, the higher the recoveries will be. Self-pay for medical practices, it's one of the fastest growing segments, and the uninsured in America is about 47 million people, and that was just in 2006 alone. And what we found out is that medical bills, they do rank lowest on the priority level. Believe it or not, people will pay their cable bill, their cell phone bill, their oil bill, especially in the winter, but the doctor's bill from 1 to 20 runs around 17 and 18, and actually the vet is about 20.
Oh, really? I thought the vet always gets paid first in cash.
Well, there's still some, if there's an emergency situation and someone just happens to leave their wallet at home and then the cat doesn't make it through the surgery, then, well, here comes the bill and it just doesn't get paid. And again, we find out that the average, patient's responsible for 35% of their own medical bills, and that's increasing. I was just discussing with my wife that when we first had insurance through her company, our co-pays were $5. They're now up to $20. That's a significant increase in 5 years.
Paul, you have a captive audience of a few 100,000 doctors sitting in their car in their office right now listening to you. What do you want to pound into their heads? How do you want to change their thought process in terms of collections and thinking about it differently? You started at the beginning of the show saying it's like a stolen car, but give me a better one.
If I can get one point home is when you folks are looking at your aging report, you have to look at it with your head and not your heart. And again, establish a relationship with a third party, a collection agency such as Transworld Systems. And again, with a diplomatic approach, we can get that money recovered a little bit sooner. Again, doctors' bills, their insurance costs are increasing every single year. But at the same time that's increasing, so isn't their self-pay balances. Again, what's even worse about the people not paying is word gets around town, doctors, that Dr. Kaskel is not great at collecting money. Go see him. It's like almost free doctor care. Mm-hmm. That's probably one of the biggest detriments of letting that self-pay balances increase out there. Again, get on them sooner. Getting the doctors to sit down and look at the aging report is also one of the hardest things. We will talk to office managers, and they'll just say everything is fine. But in reality, we may find out that 20, 30, 40, 50% of the receivables is over 120 days. That's your money, doctors, that you earned. You need to get paid for it.
Well, Paul Donadio, thank you very much for coming on The Business of Medicine today.
Thank you, Dr. Kaskel. It was a pleasure.
My guest has been Paul Donadio, the District Sales Manager for Green Flag Profit Recovery by Transworld Systems. You've been listening to The Business of Medicine on ReachMD XM 157, the channel for medical professionals. At ReachMD, we welcome your comments or criticism, so send me an email at reachmd.com and let me know how I'm doing, how we're doing, and what you'd like to hear. Thanks for listening.